Hi guys, John Zombro here with the Lifetime Body, and I hope you're having a fabulous day. Today's topic, here with the whiteboard and the pointer, is injuries, and this is part 2. I recently posted a video which was entitled Injuries Part 1, and we looked at the mechanism of acute injury and how the body heals, and also how we can manage that. And so if you'd like to check that out, I'll certainly put a link to that in the description box below. So today we're going to talk about chronic injuries. And chronic injuries are really those types of injuries which are stuck, if you will, in the scab phase. And you'll remember from last time, if you viewed that acute injury video, we have a bleeding phase of the initial portion of the injury, then we have that time period of scab formation, and ultimately we go into the scar phase and remodeling of the tissue. So a chronic injury, for any number of reasons, can be stuck in this scab phase, and common terms that we often see would be things like itis, such as fasciitis, or osis, tendinosis, apathy, a myopathy or a muscle injury. And many times we consider these things to be overuse injuries. And my only point that I would make is that the human body was made to be used. And so it's very difficult to overuse the body. But if things aren't quite right, we can certainly overload a tissue or an area. And that's really what we get into with the mechanism of chronic injuries, with most of them, is this thing we call movement dysfunction. And you'll notice that dysfunction is underlined because it's a key term that we are going to use in today's discussion. So when movement is less than ideal, we get some things happening in our body which are undesirable, and that essentially results in poor force management. In other words, forces that are being born or moving through the body are not being managed appropriately the way we're designed to do, and ultimately we get some excessive loads on a tissue or numbers of tissues. And if that load exceeds the tissue's tolerance or threshold of tolerance for accepting and dealing with that load, we get inflammation and ultimately breakdown in the tissue, or high potential for that. So how the dysfunctions are manifested, there are really 3 deficits which occur, and that could be that we have a restriction in mobility in our body, and the body just doesn't move, it doesn't have the capacity to move in the way that's necessary to properly distribute force. We may have insufficiencies in our stability. In other words, we may have some laxity or hypermobility, wiggle or wobble at a joint or in a limb, which is causing overload. So that's an insufficiency in stability. And finally, we may have ineffective motor programs. In this case, the body may be capable or may not have any restriction in its mobility or stability, but something's not quite right with how we're doing a movement. So we may lack some coordination or the ability to recruit muscles appropriately, those sorts of things. All those deficits then ultimately require us to use interventions to finally resolve the chronic injury. So before I talk about that, I want to briefly say there's absolutely nothing wrong with treating symptoms. And sometimes we need to do that, whether that's adjunctive to other treatment or just to get some relief from discomfort. And those things like ice or heat or medication or many clinical modalities, there's a place for them. But ultimately, we don't get rid of a chronic injury until we use interventions that correct the deficits. And this is super simplified because I said stretch, strengthen, and correct. Well, in reality, if we have a mobility restriction, stretching might be one tool that we use in our clinical toolbox. However, there might be a number of manipulation, massage, tissue techniques that we would employ. Then we have strengthen, and that might be increasing raw strength or hypertrophy within a muscle, but many times it might be increasing the ability of the muscle to activate and fire, or its endurance or fatigue resistance. And so that's kind of a bucket term there. And then lastly, correct. We want to correct movement patterns. So that's done with focused training, where we learn or relearn sometimes the original, ideal, proper movement skills that our bodies benefit from having. Ultimately, when we have addressed the deficits with the interventions to correct the dysfunction, we get to this point where we want to see how well we've been doing. And so ongoing as a process, we want to assess what we're doing and adjust it to make sure that it's fitting the needs of each individual at each stage in his or her recovery. And ultimately we evaluate towards getting a positive outcome. And that's really what this is all about. In fact, it's all about something I figured out in myself a long time ago, which is a little thing that I call, without being condescending at all, UMS. And UMS stands for, believe it or not, ugly movement syndrome. And I had seen myself in the mirror and in some videos moving a bit ugly. And I thought, well, this is inappropriate and I need to correct this, particularly in my role in working with thousands of people, coaching, training, rehab, that kind of thing. And so I took this upon myself, and I noticed that when I was moving ugly, I was probably decreasing my performance, increasing my risk of injury, and ultimately decreasing my orthopedic longevity. In other words, how well my body was going to work through a lifespan. But when I applied to my ugly movement system the corrections, I got the factor. So the onlookers, and myself in the mirror as well, would now see the movement as somewhat more graceful, poetic, artistic, and there's a bit of a stretch there when we're talking about me, but I think you get the picture. So if we address our ugly movement and we get the factor, ultimately everybody wins. Both the owner of the body that's doing the moving and the onlooker or audience. So that's what we have for chronic injuries today, and I hope these things give you some ideas and some information that you can make use of. Thanks again for watching, and if you're enjoying this content, of course, please, you know the drill, like, share, and subscribe, and I really appreciate that. And until next time, have a great day.